today's session of Future of Aortic Intervention, we'll cover a wide range of topics. So we'll talk about stent technology, and also we'll talk about the hemodynamics in the arch, as well as the ascending and descending aorta and how that affects the design of the stents. We'll also talk about the training and preparation of future generations of interventionists so they can deliver safe as well as effective aortic intervention.
Today's session, the personalized treatment of ACC, you will see worldwide famous experts talking on uninodular disease, a multinodular disease, a vascular invasion disease. So you'll see a complete real case scenarios, how to deal with them, how to face with them. So this is going to be an exciting topic for you. In my lecture, we'll be focusing on the tumor board decision, how to manage these multinodular big tumors with ACC. So every single visit is very important for this patient. So you will see in my lecture how to manage these patients every single step of the treatment response, of the imaging response, and after decision of the treatment, you will see the tumor board discussions. Everything is going to be live.
So today's session is going to be about vascular access in pediatric patients. Our first speaker is Dr. Prem Patel. He's from Great Ormond Street Hospital, and he is actually a wonderful speaker. He's going to be talking about actually getting neonatal vascular access and Hickman catheters and how to actually do that and the things you actually have to watch out for in children. My talk is next, and that's about neonatal vascular access. And so, dealing with these very, very small preemie babies and what you can actually do, what kind of equipment you want to source for. And then the last speaker is actually going to be Dr. Tuning, and he's from Boston Children's Hospital. He's going to be talking about alternative methods of vascular access. What do you do when you've run out of places to go?
So in today's session about fundamentals in stroke, we will cover some topics that are still under discussion for mechanical thrombectomy. Well, we all do stroke treatment and we all do mechanical thrombectomy, but there are several questions which are still open. For example, which imaging technique to use, which thrombectomy technique to use. There are several kinds, for example, aspiration, stent retriever, and so on. And how to handle or how to deal with problems with anti-aggregation and anti-coagulation. Today's session won't answer all these questions, but it's a forum where you can discuss these open questions with experts. And I will talk about imaging for endovascular therapy. I will talk about how to choose the appropriate imaging technique. I will talk about CT angiography and CT perfusion and pitfalls of all techniques, and I will reveal a well-guarded secret about thresholds in CT perfusion imaging.